Hi, I'm Guy Massry. I'm an ophthalmic, plastic, and reconstructive surgeon in Beverly Hills. I do a lot of revisional eyelid work, and today I wanted to talk to you about a particular concern with lower lids, a problem that occurs after surgery called lower eyelid retraction. I call this post-blepharoplasty, which is cosmetic eyelid surgery, lower eyelid retraction. And I wanted to show a perfect example of what the problem is. This young woman, who's been kind enough to allow us to use her photos, had surgery and the lower lids were pulled down. And these are the characteristic findings. The lid is pulled down, there's white that's shown between the colored part of the eye and the lower lid, and the outside of the lid's a little bit rounded. It causes not only a distortion in appearance, but also in function. Also, the outer portion of the lid is pulled down as the cheek drags it down from all the tension. Traditionally, this was corrected many years ago with skin grafts that fell into disfavor because there's concerns about scarring from the grafts. I've recently published a paper on using skin grafts and controlling the scarring with an injectable medication that modulates the wound, but that's a different subject. We're just going to talk about the new or more traditional surgery that's been used for this problem. It consists of 3 procedures: elevating the cheek to add skin to the lower lids, placing a graft on the inner part of the lid. I use tissue from the roof of our mouth, but there are cadaver tissues that can be used too, and then recreating the corner of the eye, what's called a canthoplasty. And that is the traditional surgery that's used. And she looks great. You can see that the lid is elevated, the angle of the eye looks better, and on side view you can see that also. But what I will tell you is that this is a complicated procedure that not everyone should venture into. You need to have a lot of experience with it, and that it's fraught with its own potential sets of complications. So if you have this problem, a pulled down lower lid and a rounded eye after having lower blepharoplasty surgery, be really careful about getting this addressed. You don't have many shots at this, and even in the best of hands it can be tricky. So someone with a lot of experience is very, very important. You can also address these issues with filler. Filler can also lift the lower lid and make this look better. You have to be a good candidate for it. As I said, it can be addressed with skin grafts, and there are some other variations of procedures, some of which I've also been involved in literature with, that can be used. The most important thing, I think, is when you're having your surgery the first time, to make sure that you don't have a procedure that puts you at risk of this. Now, this has only been shown to occur, or primarily been shown to occur, when the lower lid surgery is done through the skin of the lower lid. If you do it from the inside of the lid, you almost never see it. That doesn't mean that doing it from the outside through the skin of the lower lid is a bad surgery. In many instances, it can be a good surgery, but you have to be a good candidate. And there are particular factors that make you a good candidate and a bad candidate. And the only way to stay out of trouble is to see an expert in the field who can evaluate the most appropriate procedure for you. But if you have these problems, I have a lot of interest in this area, and I'm certainly happy to see you, and thank you for your attention.